Have you ever been told that when it comes to diabetes, it's just a matter of taking any old pill? It can be unsettling to discover how many of us believe all anti-diabetic medications are basically the same. If you're over 70, you've likely encountered this viewpoint from well-meaning friends, or perhaps even overheard it in a waiting room. Yet our bodies undergo significant changes as we age, and those changes mean our medication needs and their potential side effects also evolve. The stakes couldn't be higher. Managing diabetes properly in later life protects not only blood sugar stability, but also independence, mobility, and overall well-being. One of the biggest challenges seniors face is sifting through conflicting information. You might hear, "Take this pill, it'll lower your blood sugar just like the others," or "Don't worry, any medication will do the job." Meanwhile, you're trying to keep track of other health issues, medication schedules, and lifestyle adjustments. It's easy to feel overwhelmed or to assume that if you've been prescribed one diabetes medication in the past, it must be the right one forever. But here's why addressing this thinking matters. The wrong medication or dose can lead to issues ranging from dangerous dips in blood sugar to disruptive side effects like digestive troubles or nerve pain. More importantly, you deserve a personalized plan that keeps you active and safe, rather than a one-size-fits-all approach. By the time we're through, you'll see why believing all anti-diabetic medications are the same can undermine your health after 70. You'll discover what you can do instead to manage your diabetes more effectively. We'll walk through 5 key insights that help you challenge common assumptions, ask better questions during doctor visits, and make changes, small or large, that can improve how you feel every day. Imagine the relief of knowing you're not just taking something, but making informed decisions about how you care for your body. That feeling of security is well within reach. For the past several years, I've interacted with older adults who navigated the same tricky crossroads, juggling existing prescriptions, new diagnoses, and the general belief that all those pills are basically identical. In fact, many seniors share stories of their lives improving dramatically once they realize subtle differences in medication types really matter. Differences that can become even more pronounced with each passing year. You don't have to be a medical professional to spot the red flags or ask the right questions. You simply need to be equipped with knowledge that helps you collaborate more effectively with your healthcare team. So let's explore how these insights can make your daily routines safer and more manageable. By the end of this discussion, you'll have practical tips for medication management. You'll know what to watch out for in terms of side effects and interactions, and you'll have a clear understanding of the role diet and exercise play alongside your prescriptions. Ultimately, it's about gaining the confidence to take control of your diabetes rather than letting it control you. Before we dive in, think about your own experiences. Have you ever been unsure if your current medication is truly right for your age and lifestyle? Keep that question in mind, and let's begin our journey together. Here's the first key insight that challenges the idea that all anti-diabetic medications are the same. A lot of us assume that a medication is basically just a quick fix. Swallow a pill, lower your sugar, job done. But let's look closer at why this is oversimplified. For instance, some of the older medications primarily stimulate your pancreas to produce more insulin. Others help your muscles or fat cells use insulin more effectively. Still others reduce how much glucose your liver releases or how quickly your intestines absorb sugar. It's not just one big diabetes pill category. There are multiple classes, each affecting your body differently. Many seniors hold the misconception that if the medication brings their sugar levels down, that's all that counts. In reality, the variety of effects matters a great deal. For example, a 74-year-old named Bernard believed the only difference between 2 popular anti-diabetic medications was the price tag. He figured if both lower my blood sugar, the cheaper one must be better. But after switching to the less expensive medication without consulting his doctor, Bernard experienced frequent bouts of low blood sugar, episodes that left him dizzy and at times dangerously close to fainting. Only later did he learn that the cheaper medication worked differently in his body than the one he'd been on. The side effects were specifically risky for his age, especially because he lived alone and had no one to assist him when he felt faint. This is where evidence-based insights come in. Studies show that certain medication classes may be more appropriate for older adults with heart conditions, while other classes pose fewer risks of low blood sugar episodes. A one-size-fits-all approach overlooks individual factors like kidney function, other prescriptions you might be taking, or your dietary habits. An older adult with heart concerns, for instance, might benefit from a medication that's gentle on the cardiovascular system. If you're prone to forgetting meals or struggle with appetite, a medication that sometimes causes lows might not be the safest choice. So what can you do instead? First, ask your healthcare provider, why is this medication class right for me? Or, should I consider a different one? These questions open the door to conversations that are more personalized. Second, keep track of daily blood sugar readings and note any changes in how you feel, especially when starting a new medication. And finally, never switch or stop a medication solely based on cost or convenience. If finances are a concern, let your doctor or pharmacist know. They can often suggest programs or alternatives that fit your budget and remain safe for your specific conditions. When you adopt this approach, you don't just protect your physical health, you also preserve peace of mind. Knowing you're on a medication suited to your unique needs reduces the lurking worry about, what if something goes wrong? That sense of safety makes day-to-day activities more enjoyable, because you're not carrying around the stress of unexpected side effects or the dread of low blood sugar episodes. Moving forward, let's consider another assumption many seniors make about anti-diabetic medications. Sometimes it's not about the overall class of medication, but how you handle it in real life that matters. A second widespread assumption is that once you're prescribed a particular dose, you can stick with it forever. We often hear, my doctor said 10 milligrams a day, so that's what I do. End of story. In truth, our bodies change as we age, and the right dose at 65 might not be the best dose at 75 or 85. This misconception comes from decades of thinking that diabetes management is essentially set it and forget it. But the reality is much more nuanced. Many people believe their blood sugar readings are stable because of an unchanging dose, without realizing that stability might be masking underlying fluctuations. Take Evelyn, a 77-year-old widow who was given a standard prescription for her type 2 diabetes in her mid-60s. She proudly stuck to the same dose for more than a decade, thinking consistency was key. Over time, her kidney function changed, and her doctor recommended adjusting her dose. However, Evelyn insisted she felt fine, so she refused. Over the next few months, she began experiencing unusual fatigue and occasional blurred vision, signs her medication levels were no longer safe. The dose that once worked perfectly for her had become problematic as her kidneys processed it differently. Only when she landed in the emergency room did she realize that fine was not the same as healthy or ideal. It's important to recognize that dosage adjustments are not admissions of defeat or indicators that your health is failing. Instead, they reflect the dynamic nature of aging. Clinical research supports the idea that seniors often require careful recalibration of medication to avoid complications like hypoglycemia or increased stress on the kidneys. Your body might metabolize the medication slower or faster, or you might have new conditions that interact with diabetes management. This is why routine checkups and blood work are so crucial. What does a better approach look like in everyday life? First, schedule regular medication reviews with your doctor or pharmacist, ideally every 6 months to a year. At these appointments, discuss any shifts in your energy levels, appetite, or sleep patterns. Bring your most recent blood sugar logs. Doing so helps your healthcare team see patterns and decide whether a small tweak in dosage might improve your quality of life. Second, make sure you're aware of other medications, vitamins, or supplements you're taking. Interactions can amplify or reduce the effectiveness of your diabetes medication. Third, pay attention to subtle changes in how you feel. It's easy to dismiss minor symptoms as just old age, but they may be signals that your medication is no longer aligned with your body's needs. The emotional benefit here is significant. Adjusting a dose when needed puts you back in the driver's seat. Rather than letting life happen to you, you take an active role in shaping your health journey. You're also less likely to feel fear or guilt if your blood sugar veers out of range, because you'll understand that such fluctuations can be a normal part of aging and are often fixable with a dose change. Before we move on to the next insight, ask yourself, Have you been on the same dose for years without revisiting it? If so, consider bringing it up at your next doctor's visit. Small changes can make a big difference in how you feel day to day. Next, let's challenge a third assumption that often prevents older adults from getting the full benefit of their diabetes medications. There's a lingering myth that if your blood sugar readings look okay, you don't need to worry about what time of day you take your medication, or whether you skip it every now and then. This stems from the assumption that all anti-diabetic pills work around the clock in the same way. In truth, the timing of medication can dramatically influence its effectiveness, particularly in older adults who may have variable meal schedules or different levels of physical activity. A common misconception is that as long as average blood sugar is under control, the details don't matter. But consider Manuel, 81, who prided himself on near-perfect morning glucose levels. He often took his medication late in the afternoon simply because it was more convenient for him to remember. The catch: his medication was designed to work best in conjunction with a substantial meal, and Manuel's biggest meal of the day happened to be breakfast. By the time dinner rolled around, he was only having a light soup. Over time, his doctor noticed that his A1C levels started creeping up, indicating longer-term higher blood sugars. It turned out that his habit of taking the medication at a time unrelated to his main meal was slowly eroding his overall control, something he didn't see in his day-to-day fingerstick readings. Research suggests that for certain medications, like those that help the body produce insulin, it's crucial they're taken before or with a meal to prevent potential lows or highs. Other medications might be more flexible, but still work best at a consistent time each day. It's not just about the medication itself, but how it fits into your personal routine, including when you eat and whether you engage in physical activity. As seniors, many of us also have fluctuating appetites or meal schedules that differ from the standard breakfast, lunch, dinner pattern. That means timing becomes even more personalized. How can you optimize your medication schedule? Start by reading the instructions carefully and asking your healthcare provider to clarify anything that seems vague. If a label says, "take with food," ask if it matters which meal. Also, be honest about your own habits. If you typically eat your biggest meal at midday, it might be worth coordinating your dose with that meal for maximum effectiveness. Keep a simple log for a few weeks where you note what time you take your medication, when you eat, and how your blood sugar responds. Patterns often emerge that make it clear how timing affects your results. The physical benefit is that you're more likely to maintain stable blood sugar levels throughout the day, avoiding those peaks and troughs that can leave you feeling fatigued or anxious. Emotionally, it's empowering to see how a small shift, like taking your medication 30 minutes before breakfast instead of after, can yield better energy and mood. It's a reminder that our daily choices matter, and it puts the control back in your hands rather than in the pill bottle alone. If you're finding this information useful, let's take a quick pause. Reflect on your current medication schedule. Do you take your pills at the same time each day, or does it vary? Have you checked with your doctor whether the recommended timing aligns with your meal patterns? By simply aligning your medication times with your lifestyle, you can gain greater confidence in your diabetes management. We've covered 3 important points so far, but there are more misconceptions to address. Let's move on to the next insight that many seniors overlook. Another common assumption is that medication alone is enough, that as long as you're taking your prescribed pills, you can be lax about exercise or diet. After all, if the medication is doing its job, does it really matter if you add an extra snack or skip that daily walk? This viewpoint is tempting because it allows us to rely solely on a pill rather than making lifestyle adjustments that can feel burdensome. Yet for seniors, the interplay between medication, nutrition, and physical activity is especially critical. Neglecting one area can undermine the benefits of the other. Too many older adults fall into the trap of believing that an active lifestyle is optional once you're on a prescription. But consider Jean, 72, who had been on her diabetes medication for years. She used to enjoy strolls around her neighborhood, but gradually tapered off after her doctor added a new pill to her regimen. Jean thought, why bother walking if my medication is controlling my blood sugar? Over time, she began experiencing muscle weakness and slower balance reflexes, both of which are common in aging, but can be intensified by lack of regular movement. Her blood sugar started fluctuating more too, because the medication was never meant to be the sole tool for glucose control. By reintroducing short, gentle walks and occasional stretching exercises, she not only felt more energetic, but also found her medication worked more smoothly in tandem with her daily activity. Clinical findings repeatedly show that combining even mild to moderate physical activity with the correct medication can reduce the likelihood of complications such as neuropathy, nerve damage, and cardiovascular issues. Additionally, paying attention to a balanced diet high in fiber and protein can help medication maintain a more stable blood sugar range. It's not about punishing yourself with restrictive diets or intense workouts. It's about small, sustainable efforts that complement the medication's function. How do you bring this into your daily life? First, identify a simple movement routine that fits your abilities, whether it's a short walk, gentle chair exercises, or light swimming. Start with just 10 or 15 minutes a day. Second, be mindful of your meal composition. Try to have at least one vegetable in each main meal and opt for whole grains when possible. Third, experiment with your timing. If you take your medication before breakfast, consider going for a slow stroll afterward to help your body utilize glucose more effectively. These small actions can amplify the benefits of your prescription, making each dose more effective and reducing the risk of swings in blood sugar. Following these steps does more than just stabilize your health markers. It also instills a sense of purpose and self-reliance. Instead of feeling like a passive recipient of medication, you become an active participant in your well-being. When you see your energy improve and your blood sugar stabilize, it can be incredibly uplifting, proof that you have control over your own health journey. Before we tackle the final insight, take a moment to consider whether you've been relying too heavily on medication alone. Could there be a small lifestyle tweak you're willing to try this week? And what emotional or physical benefit might you gain from that change? Now let's explore one last myth. The notion that discussing potential drug interactions is overkill. Many older adults think, I've been on multiple medications for years. If there was a problem, I'd know by now. It's a comforting belief but can lead to dangerous oversights. With every new medication or supplement, the potential for interactions increases. And because your body's metabolism evolves with age, a once harmless combination can become problematic down the road. The misconception here is that if you haven't felt any overt signs of trouble, you're in the clear. But consider 75-year-old Harriet, who had been on a blood pressure medication and a diabetes pill for years. She started taking a popular herbal supplement for joint pain, thinking it was completely safe. Within weeks, Harriet found herself dizzy more often, and her blood sugar readings showed unexplained spikes. By chance, she mentioned the new supplement to her pharmacist, who informed her that it reduced the effectiveness of her diabetes medication, causing her body to absorb more sugar than intended. Harriet's dizziness was also linked to fluctuating blood pressure levels, as the supplement mildly interacted with her heart medication. Had she not brought this up, it might have led to a serious episode of fainting or a more severe complication. The evidence is clear that polypharmacy, the use of multiple medications, is common in seniors and needs close oversight. Different drugs and even certain vitamins can interfere with each other, sometimes in unexpected ways. Healthcare providers are generally attentive to these risks, but they can't help if they don't know everything you're taking. This is why full transparency is essential. What can you do to stay safe? First, maintain a complete, updated list of all your medications, including non-prescription items like over-the-counter pain relievers, antacids, vitamins, and herbal products. Keep this list handy, on your phone, in your wallet, or somewhere easily accessible. Second, make it a habit to mention any new supplement or medication you start, no matter how innocuous it seems. Third, whenever you have a medication review or doctor's appointment, specifically ask about interactions. Do any of these items conflict with each other? Or is there something I should stop or switch? The reward for this vigilance is peace of mind. You're far less likely to suffer an unexpected health scare or a sudden drop in energy that you can't explain. Emotionally, you'll also feel more confident about your choices because you'll know you're not ignoring potential red flags. You're essentially building a safety net that protects you from the unseen complications of juggling multiple prescriptions. We've now looked at 5 key insights that dismantle the idea that all anti-diabetic medications are the same and highlight how to handle medication properly in your 70s and beyond. Remember, each point is not just about avoiding danger, it's about creating a life where medication supports your independence rather than limiting it. As we wrap up, let's bring everything together in a way that inspires you to take the next step. If you've stayed with me so far, you've gained a deeper understanding of why not all anti-diabetic medications function alike, especially once you pass age 70. You've learned how medication classes differ and why your body's changing needs may require fresh conversations with your healthcare provider. You've seen that dosing is not a one-time decision, but an evolving process that should reflect how you feel physically and emotionally. You've also discovered that timing matters. When and how you take your prescription can be as important as what you take. We explored why relying on medication alone, without supportive lifestyle habits like exercise and nutrition, can shortchange your results and leave you feeling more reliant on pills than necessary. Finally, we shone a light on the often overlooked issue of drug interactions, emphasizing the importance of ongoing vigilance, especially for seniors juggling multiple medications. The urgency here is real. Diabetes is a progressive condition that can lead to serious complications if mismanaged. But there's no need to live in fear. By staying proactive, asking questions, keeping track of subtle changes, and seeking regular medication reviews, you can often catch the small problems before they become major hurdles. You might notice a slight uptick in your blood sugar readings or experience an unusual side effect. Addressing these issues early can make all the difference between a small dosage adjustment and an unnecessary trip to the hospital. Try picturing yourself a few months from now. You've talked openly with your pharmacist about those vitamins you've been taking, and you've either confirmed their safety or found a better alternative. You've set an alarm on your phone or watched to remind you to take your medication when it's most effective. Perhaps you've started a gentle daily walk after breakfast or dinner. Each of these steps helps you feel more confident, stronger, and in control, instead of merely hoping your diabetes remains manageable. If you're ready for action, here are some immediate steps you can take. Start by listing all your current medications, prescription, over-the-counter, vitamins, supplements, on a single sheet of paper or in a digital note. Next, schedule a brief consultation with your pharmacist or doctor and bring that list with you. During that appointment, ask if there are any potential interactions or if a medication review is due. If you need something more flexible and can't get to an in-person appointment easily, consider calling your doctor's office to request a phone consult. It's a quick step that can bring enormous peace of mind. For those looking to go deeper, consider joining a local or online support group for diabetes management, especially one geared towards seniors. Seeing how others handle medication changes, exercise routines, and dietary tweaks can spark ideas you might never have considered. If you're the kind of person who appreciates more personalized guidance, ask your doctor about referrals to a certified diabetes educator or a dietitian experienced with older adults. That's a fantastic way to get tailor-made strategies that align with your lifestyle and preferences. Finally, if you found this conversation enlightening, share it with a friend or family member who's also navigating diabetes in later life. Being part of a supportive community can make all the difference in staying motivated and informed. The best part is that you're fully capable of making these changes. Seniors aren't powerless bystanders to their health. You've lived long enough to know how to adapt, persevere, and keep learning. That's the empowering message I want to leave you with. You have the wisdom, and now you have more information to guide your next steps. Your medication can and should work for you, not the other way around. And by recognizing that not all anti-diabetic medications are the same, you open yourself up to a more personalized, safer, and ultimately more effective way to manage your diabetes at 70 and beyond.